Yes, good afternoon and welcome to Tampa Bay, Florida. We're here at the American Society of Radiologic Technologists annual symposium. I'm your guest lecturer, Brian McAlpine, and my current role is epidemiologist for New York State Department of Health. I'm going to be talking to you this afternoon on an update for bacterial infection testing methods on the Meisel-Mur disease, which was first discovered in Ansan, South Korea, back in 2023. Now, as many of the clinicians in the audience know, the gold standard for diagnosing and testing for this disease was magnetic resonance imaging of the brain and as clinically warranted levels of the spinal column, and we would do that with and without gadolinium-based contrast dye. Some of the new testing methods, however, eliminate the need for gadolinium contrast, especially in particular populations such as those with kidney function who has been compromised, pediatric and pregnant populations. The test results are much more rapid, and it's much cheaper than traditional imaging studies for diagnosing this particular disease. As a recap, the novel Meisel-Mur disease and associated infection pattern, it's a waterborne upper respiratory tract infection that has associated inflammation of the brain and spinal cord. It can be potentially fatal in younger and vulnerable populations. It's being found outside of South Korea now, increasingly in river systems worldwide as climate change continues to manifest, and there are few therapeutic treatments. Meisel comes from the fungal network and Mur from the Korean word water, where the disease was first discovered, so fungus water basically. As I had mentioned, MRI was the gold standard for diagnosing and recognizing this disease. We used diffusion-weighted imaging and post-contrast imaging. The diffusion-weighted showed us restricted blood flow, and the contrast showed us lesion enhancement. I've got a couple examples here of some of the lesion enhancement on an axial and a coronal post-contrast image. The reason that we're trying to move away from the contrast dye is some risks outlined by the FDA. You know, there's the risk of nephrogenic systemic fibrosis, potential retention of contrast, and then, as I had mentioned previously, you want to look out for compromised kidney functions. We want to get a GFR usually above 60. The new diagnostic testing method is a nasal swab. It's dubbed the kokuri, or elephant, and it was created in partnership with Seoul University. As I had mentioned, it's safe, it's effective, and it's cheaper. We'll go over some of the latest study results. We have our table here, and then we can talk about prevalence. We had about 14% of the population with the disease. For sensitivity of the test, we were happy with these results. It was able to properly diagnose a diseased individual 91% of the time. Where the test fell short was in its specificity. It was very, very low, only about 15.78%. And again, this is how often will our test identify a non-diseased individual as being negative. Something we want to look out for, something we want to tweak for future iterations of this test. We can also look at positive and negative predictive values. Again, kind of a big divide on these, something we want to look out for and make known to our patients. So because of sort of the wide margins on the specificity and sensitivity, we want to just emphasize that it is a safe, minimally invasive diagnostic test when compared to contrast-enhanced MRI. But we want to make known that due to the low specificity and low positive predictive value, it should be used with caveats until, as I said, future iterations can be developed. Results should be explained to patients in simple terms, and it should be made known that because a patient has a negative test, it doesn't necessarily mean they are disease-free. And depending on their kidney function and patient status, if they're pregnant, if they're a pediatric case, MRI may or may not be the next step. This test should be absolutely considered with patients that have contrast dye or compromised kidney function, again, the pediatric and pregnant populations. I thank you for your time and look forward to hearing from future presenters at our symposium this year. Thank you.